Adonis Athletics. Again, I'm joined by the Ginger Professor, Alex Fielding. Obviously, last video that he did, we went through some stuff with hip impingements and how to manage them and things like that. Today, we're going to talk about tendinopathies and things like that. It's got to do with the knee. So, a very common thing that you experience with, or I experience, or a lot of guys who are heavily involved in training and powerlifting, is knee pain, either right above the kneecap or right below the kneecap. And Alex is going to go through and tell us all what that pain is, how it comes about, how to manage it, and then how to manage it until you see somebody like Alex so you can fix it, make it go away.
Yeah.
Let's go.
Alright, so tendinopathy is probably one of the most common things we get with powerlifters, and the main reason for that is a lot of the load and the amount of force that has to go through a lot of the joints can sometimes be too much for some of the structures and the tendons in place. So we've got a lovely little knee here. So what we're really talking about is knee pain just below that kneecap there through this tendon here, or just above it through that upper part of that tendon just through there. So when we're talking about tendinopathy, what it really means is this structure here, that tendon, has lost its ability to accept the load or that pressure that person's putting upon it. So what happens there, it can get a little bit inflamed and it can get get quite sore and painful. And it's one of those things that can really limit a powerlifter's ability to move forward and progress their training to hit their targets and what they need to be able to achieve for the next comp or for their own personal gains. So with a lot of this sort of thing, prevention is the best cure. One of the best things to do is to make sure that with your training program that it's progressed adequately for you and it's not doing any big spikes over about 150% of what you're normally doing. And importantly, it's consistency. So when we're looking at injury risk, if you're doing less than 80% of what you normally do or above 150% of what you normally do, you are at risk of developing a bit of this tendinopathy here.
Meaning in terms of total volume?
Yeah, so total volume. So one thing that we have a look at is a thing called the acute to chronic load ratio. Yep. So we basically take an average of what you've lifted over the last week as an average over the last month. Yep. And we want that to lie between about 80% and 150%. So you point 0.8 to 1.5.
Why would problems occur if it's under 80%?
Deconditioning. So one of the big issues is, as if people aren't training well and they're having this big fluctuations, is the tendon hasn't adapted appropriately to be able to take up that force.
Yeah, right.
So that's the best case scenario, is once the tendinopathy is in place, we do need to back off the training. So we're looking at starting basically back from not lifting much at all and slowly progressing that over time, so allow that tendon to heal adequately. One exercise that we generally use is the basic pathway which we use is we start with just basic general holds or isometric exercises. Then we progress them into eccentric exercises, so like slowly lowering that weight down. And then finally concentric exercise, so your normal lift and things like that through the normal part of it. So for example, with the squat, a simple way for us to offload that patella tendon is to be able to increase the angle of the feet. So a simple way, we'll get Amir as the demo here, is we can use a plate or a bit of a ramp, and we'll get you standing with your heels chopped up on both sides.
So basically like weightlifting shoes, basically?
Yeah, absolutely, but we want to increase, more angle the better. So then if we get you squatting down from that position there, it offloads the amount of pressure that we put through the knee compared to, so if we get you up again, and if we get you walking forwards and squatting down again, you should still feel the difference between the load going through the knee compared to that, compared to on the plate. So if we can offload it initially, allow it to be comfortable with that weight and build it up from there, we can generally progress and get rid of that tendinopathy. But as we said, the main key from this is prevention as opposed to waiting till it's too late for it to come on. So be consistent with your training. If it starts to flare up, take it easy, and if that's still not doing the right thing, come and have a chat to us.
By the sounds of it, it sounds like the cause could be from a number of different things. So probably the best thing would be for the athlete to obviously, I mean, if they want to try a couple of things like stretching or whatever, but if it's not going away,
absolutely,
definitely come and see somebody.
Yeah, so
sort
Yeah, so generally what we recommend with these sort of things is try a little bit of rest for over about a 2-week period, back off the training a little bit, try some simple eccentric type exercises there, and then if that's not enough by that stage to settle that down and get back into your training, then come and see either me or somebody else regarding it and try and get a better process moving forward for you.
So that's another episode with the Ginger Professor and I. We're going to try and keep shooting these out to you on a weekly. If you guys have any problems, any more questions, ask us. If you guys got problems not going away, come down. Adonis Athletics GRANVILLE, book Alex in, and he'll sort you out. Till next time.
See you around the gym sometime.
All right. I'm here from Adonis Athletics for another little quick tip. There's a notion that, or just a thing that I notice from time to time